Transfusion of blood saves millions of lives every year. Although the need for blood is universal, there is a marked difference in the level of access to safe blood across and within the country. In Ghana, blood services face the additional challenge of making sufficient blood available while also ensuring its quality and safety. In the Volta Region, for example, about 17,000 units of blood is needed annually to be able to save lives of people in need of blood. This has become a challenge to most hospitals in the region, as over 6,000 people are required to donate blood at least 3 times yearly. The figure has, however, become difficult to come by, as most people are not willing to donate blood. Speaking to Citi News, Deputy Blood Donor Recruiter at the Volta Teaching Hospital, Vincent Pepe, said the collection of blood for the blood unit at the teaching hospital has reduced significantly before and during the COVID era. According to him, this has been a challenge to the hospital, and noted that the blood unit lacks resources to educate the public on the need to donate blood to the facility. He said the unit has to rely on close relatives to provide blood for patients.
Many people are not coming forward to donate blood for so many reasons. People complain about low incentives for the donors, and others also talk about our education not being very strong. And for Volta Region, I can say it's true. We rely on family members to come and supply blood, or we get blood from other facilities in the region to support our collection.
But to help augment the existing blood at the unit, and as part of their social responsibility, the 66th Artillery Regiment in Ho has donated blood to the Ho Teaching Hospital to support its blood unit and to help save lives following the impact of COVID-19 on the health sector. In an interview with Citi News, Commander for the 66th Artillery Regiment, Lieutenant Colonel Edward Sapon-Appiah, said the initiative reinforces the regiment's resolve to support the hospital in saving lives.
Every year, we come here to donate blood, so it has been like a ritual. And the blood donation is to help save life. So we have taken it as a unit to do it every year to save people's life, including our personnel. Most of our referrals are also come to this hospital when the situation demands. Instead of going to 37 Military Hospital, this is the first point of call before the person is transferred to 37 Military Hospital. So there has been a long-standing relationship between the unit and this hospital. This blood donation we have done is available for the use of the general public. So you don't need to worry yourself calling people to come and donate blood for you when we have some already available.
The Deputy Blood Donor Recruiter at the Ho Teaching Hospital, Mr. Vincent Pepe, commended the military for their support to the unit. He, however, urged the public to own the blood bank and voluntarily donate to avert any disaster.
Advice to the public is that they should own the blood banks or the National Blood Service, because it is the public that will donate before we will get enough blood to supply to people who need it. Regular voluntary blood donation is what the service wants, and voluntary blood donation helps to save situations. For that one, we have collected the blood, screen it, label it, store it for distribution. So anybody who needs it, the blood is there, we will quickly go for it. But when we want to wait for people to fall sick before relatives and family members come on board to donate blood, many lives will be lost.